I've gotten to the patient's chart. I've familiarized myself. It's C. Jones here for heart failure. I have already given her peri-care, pre-medicated her for any pain medication, and I've gathered my supplies and I'm ready to go into the room. Okay, so knock knock, give privacy. Hi, Miss Jones. My name is Marilyn. I'm going to be your student nurse today. Awesome. Yeah, so the doctor put in an order to put in a foley catheter for you because due to your heart failure, you're really filled with fluids, and we need to closely monitor your intake of fluids and your output of fluids, and that catheter is really going to help us do that. Is now a good time? Yes? Okay, can you please confirm your name and date of birth for me? Okay. Yep, that matches your wristband. Perfect. Alright, I'm going to get you nice and comfortable. Going to raise the head of the bed for the procedure. Yeah, your peri-care has already been done. Okay, so I'm just going to gather my supplies now. I'm going to put on some clean gloves. Wipe down my surface. I'm going to let that dry. So for my supplies, I have my catheter kit with the foley. I would have an extra pair of sterile gloves and another sterile foley. A check to put under the patient. A little anchor to anchor the foley. Alright. Alright, Miss Jones, I'm gonna get my supplies ready. Actually, let's get you in the right position first. So I'm gonna uncover you now. Alright. In the most therapeutic way, I'm gonna put you in the dorsal recumbent position, kind of like a frog. So, like this. Nice little breeze. You're nice and clean down there. Okay. I'm gonna put the chuck. I'm gonna put this chuck underneath you in case we get any bit of leakage. Hand sanitizer. Clean hands always. Okay, so now I'm gonna get my supplies. That is nice and dry. Remove from the packaging. Okay. So I'm going to open this package away from me with my clean hands. Okay, going to make sure to maintain 1 inch border. Okay. Not putting my hands over the sterile field. Going to grab my gloves.
We have a 16-French foley catheter, and the rest of the materials in the...
Alright, gonna pinch. Put on the gloves.
Everything seems good. I'm also double checking.
I'm going to scoop. Alright, gloves are on. And then shiny side down, I'm gonna put this over the patient.
And I'm also going to
Alright, and then don't need this since this is a female catheter. I'm gonna get all my supplies out, unpacked. This here. Sorry. Okay, we have a little cup for a urine sample. Don't need one.
because we need to keep a closer eye on your intake and output.
to uncover the foley, making sure it stays in the sterile field.
We're gonna get started.
It's my little trash can. Gonna connect the syringe to the foley, making sure it's the right French according to the order. Yep, it says 5 to 10 milliliters. Okay, putting that on. There we go. Okay, and then I'm gonna put my, okay, the syringe does not want to stay in, but we're gonna keep going. Okay, the iodine, I'm gonna put it in there. I have the lubricant open. I'm gonna put some in the corner of the box. Okay. I'm gonna take this over with me. All right, Miss Jones, I have all the supplies that I could need right here. And so I'm gonna start off by cleaning your genitalia in 3 parts with iodine sticks. Okay, with one, your right labia front to back, toss.
And then open
The left labia, toss. And then front to back, kind of the middle area, clit to vaginal opening down. Okay, in 1 stroke. There you go. Okay, all right. That's nice and disinfected. Now, with this hand, I'm gonna touch you now. Is that okay? I'm gonna grab you. I've vocalized, or I've found the urethra. I'm gonna dip in that lubricant, about 2 to 3 inches. All right. And then I want you to take a deep breath and breathe out, okay? All right, I see urine flow. Perfect. Yeah, here. Ideally, this would be attached. Perfect. Okay. I'm gonna inflate that balloon with the prescribed amount. Okay, pushing. 10 milliliters. Okay. Now I can take this off. Alright, that balloon is nice in place. Okay, now I would take off my gloves, put on different gloves personally, and I'm going to anchor this to your leg. Making sure that there's slack, so that there's not any tension pressure when you move your legs on that foley. That is anchored, and I would put on the little label with the time, date, and my initials. How are you feeling, Miss Jones? You did so good. The worst part is over. I'm gonna hang your bag lower than your bladder. Okay, there we go. Clean up the supplies. Toss these all in the trash. Sterile field doesn't need to be sterile anymore. Gloves are off. Clean hands. Would you like to check your knee? Yes, okay. Toss them away, cover.
We are using a latex.
And we'll help you lower your legs and so comfortable. All right, Miss Jones. You did so awesome. Here's your palette. Do you need anything? Do you have any questions? Okay. All right. Just call if you need anything. I'm gonna go document now. We have a trans twin here with has a history of Crohn's, here with abdominal distension and a suspected bowel obstruction. So I've confirmed the orders. Order for NG, tube, and decompression at a low intermittent section. I have looked at his chart for allergies. I did see that he does have an allergy to satin tape. And I gathered all my supplies. I feel ready to go into the patient's room. Okay. Knock, knock. Give privacy. Hello, Mr. Newman. My name is Marilyn. I'll be your student nurse today. How are you feeling? Awesome. Is it okay if I call you Mr. Newman? Okay, perfect. So, looks like the doctor put in an order for an NG tube to decompress your stomach. Do you know what an NG tube is? Are you familiar? No? Okay. Well, basically, it's a small, flexible tube that I'm going to place in through your nose to kind of go into your stomach to take away kind of that buildup of fluid or gas, and it's really going to help you feel better, kind of relieve that pressure. Is now a good time? Okay, awesome. So I've gathered all my supplies. I'm here at the bedside. I'm just gonna raise up the bed a bit, a good working height, and I'm gonna sit you up a bit. Is this okay? Do you feel comfortable? Okay. I'm just gonna clean my hands with hand sanitizer. Alright. And just to confirm, any allergies? Satin tape? Okay, good. Okay, some tape. Making sure my tape is safe. Okay. Yep. Looks good. Can you confirm any date of birth for me? Awesome. I'll get started with that. So I have this towel for you. I'm going to drape this over you. And a little side note, so there were orders for IV and also some Zofran. I saw some ondansetron. They do have current present symptoms of nausea vomiting, so I would probably call the doctor, make sure that those meds are IV, make sure that he started on an IV, give that nausea medication 10 minutes before this whole procedure. Said now. Cool. Alright, we did all that. So here's a basin. I have this here for you in case if any time during the procedure you feel nauseous, this is for you, okay? Okay. And then during the procedure, if at any point you feel uncomfortable, want me to stop, raise your hand, okay? Okay. I have all my supplies. We're gonna say that this was in the package. Okay, open in a very sterile way. Okay. Here I have an irrigation kit. I'm gonna use the syringe. I'm gonna take off this adapter, put it to the side, connect the syringe. Keeping this nice and clean. Okay, I have my stuff ready. All right, Mr. Lynn, I'm going to do some quick assessment. Do you have any history of nasal surgery, facial surgery? Any nosebleeds? No? Okay. And then I'm going to take a look at your mouth. Can you say, okay. Close your eyes and look at your nose. Okay. I'm going to check for your nostrils to make sure that they're working right. I'm going to plug up one nostril and I want you to breathe in and out. Again. Alright. Were you able to breathe in and out okay through both? Yep. Do you have a preference for nostril? The right? Okay, we'll do the right. Sounds good. Okay, so and gag reflex, very important. Good gag reflex. I did see in your chart that you are NPO. Normally during this procedure, I would give you a cup of water to kind of take small sips. But since you are NPO, I'm going to need you to try dry swallowing as I am inserting the tube, okay? So, I have the NG tube here. I'm going to apply some lubricant.
Put your head forward.
With very clean hands. Okay. Alright, I'm gonna place this right here. Before I would lube, I would actually measure. So I'm gonna measure from the tip of your nose to your earlobe, down to your sphenoid process, and a little bit further here. So about here. Okay. And so I would mark this with tape. And I would make sure to chart also the length. I could also do a Sharpie. Okay. Now I would lubricate. Okay, I want you to take nice deep breaths and dry swallow, okay? And at some point I'm going to tell you to tuck your chin into your chest. And I'm going to need you to stay tucked in and keep swallowing. Are you ready? Okay, just relax. I'm going to advance the tube with lubricated tube. All right, tuck your chin. Tuck. Keep dry swallowing. Keep swallowing. Keep swallowing.
I would have applied
Keep swallowing.
after securing
Keep swallowing. Good job. Keep going. We're almost there. Keep going. Keep going. Swallow. 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 Keep going.
45 degrees, and you can see it's actually at 45 degrees on the side.
Okay. It is now at the taped mark. Does that feel okay? Okay. Oh, and I would also have a pulse ox on. Your oxygen looks good. I would also take my stethoscope. Breathe in and out. Okay. Your lungs sound good. Okay. Alright. Placement is good. If you could kind of hold that for me. I would also make sure that the tube is correctly in your nose. Good. I didn't hear you coughing or anything. Looks good. I'm now going to aspirate a little bit of your gastric content to test. In a little Dixie cup. Okay, I have my pH key and strip. Looks good. It's under 5 pH, which is normal for the stomach. I'm going to set that aside. Okay. Gastric contents looks good. I'm going to now secure the tube onto your nose. Okay, nice and secure. Does that feel okay? Now I'm going to secure this onto your tube and attach it to your gown. And then this. Make sure that there's a little bit of slack. I would also apply some barrier cream to this area, as well as I'd apply a barrier cream before applying the tape to make sure to protect your skin.
Once that's done, I'm
And
going
then
to set it
this.
to low,
Actually,
intermittent suction.
okay. The most important thing, I've contacted X-ray, and they're gonna wheel you away to check for placement. The placement has been confirmed by X-ray. Everything looks good. So now I'm going to help decompress the patient. Knock knock. Privacy. Okay, clean hands. Hi, Mr. Nguyen. I am back. How was your trip to X-ray? Nice and quick, huh? Perfect. Looks like it's in the right place, so I can proceed with the order to decompress your stomach at low intermittent suction. Is now a good time? Okay, so this is the suction. I would connect this.
That you would put at low intermittent and
So again, to decompress, it's just going to alleviate that buildup in your stomach and help with that obstruction. So I would apply the adapter here, connect. All right.
Oh, wait.
And the order was low intermittent, so I turn it on to intermittent. Make sure that it's on the low. All right. Are you comfortable? Does it feel okay? I see gastric content. Looks good. All right. Are you on any team? Do you need to go to the bathroom? You have your possessions. Here's your call light. All right. I'm going to document everything that